In the abdominal diastasis, there is a progressive and irreversible removal of the rectus abdominis muscle due to the yielding of the 𝗙𝗲𝗚 line and the tendon sheaths that envelop the muscles. Externally, there is a deformity, especially starting from the xiphoid up to the navel. This deformity is seen especially in thin persons during the contraction of the abdominal muscles. When you return to the rest position, the deformity disappears, but the midline remains soft to touch. By touching this region, you can feel the lack of solid tissue behind the skin. The intestine and the abdominal organs are no longer protected by the muscles. While eating, the abdomen relaxes enormously because there is no longer the containment action of the muscular wall, since the rectus muscles are unhooked from each other. There are strong backaches due to the fact that the posture is biased backwards due to the prevalent action of the back muscles on the spine. You may have urinary disorders since the bladder is not emptied more due to the low efficiency of abdominal muscle contraction. Any contraction of the rectus muscles in the presence of a clinically relevant diastasis tends to make the muscles more and more lateral and to cause a progressive worsening of the disease. There is no more force in the flexion movements of the torso, and the rectus muscles progressively become atrophy since the muscle contraction is ineffective. The procedure performed by Dr. Darecchio of 𝗏𝗏𝗏 robotic plication of the rectus muscles restores the normal anatomy and functionality of the abdominal wall. All the symptoms are resolved and the muscles start working in a physiological way again. This technique, although minimally invasive, offers the maximum possible solidity of repair. It will be possible to perform any sport activity after convalescence, and the muscles can be strengthened and hypertrophied without the risk of recurrence. Dr. Darecchio has the largest clinical experience in Italy with the highest number of patients operated, and performs these interventions in centres of excellence equipped with the latest generation of robotic technology. The aesthetic effect is excellent and the most natural possible. The deformity of the diastase disappears, the waistline is reduced, the navel regains its original shape, and there are no extensive scars but small incisions of 8 mm on the left side.